Hello, everyone, and welcome to today's webinar, Treating Musicians as Athletes. Musicians use their body with the same precision, control, and endurance as a high-level athletes. However, their injuries are often misunderstood or described only as an overuse. This webinar will help us change the way of thinking. It's a very pleasure to introduce our speaker, Saba Kamal. Saba is an occupational therapist and certified therapist with more than 30 years of experience in hand and upper extremity rehabilitation. She studied occupational therapy in India and is certified to practice in the US, UK, and Europe. She currently lives and works in the United States. Saba has spoken at many national and international conferences and has worked closely to surgeons and therapists throughout her career. She has also held leadership roles in a professional organization and is the author of the book Treating Musicians as Athletes. Recently, she completed a healthcare leadership certificate at Johns Hopkins University. So please join me in welcoming Saba Kamal.
Thank you. Thank you so much. So thank you for having me. This is something, as you guys know, very close to my heart. I love talking about this topic, and the way I deal with musicians has been very different than most people do. And because of that, I decided to write a whole book about it. I didn't know I could write so much, but I did. And so that's what I'm going to highlight in this webinar as to all the things, the way I see it, and I treat these musicians. So one thing I would like to let you guys know, I'm not a musician. My sister is. She's played every instrument there is. In fact, she's disabled, but music is something that she can play despite her disability. So I kind of wrote that, keeping that in mind. So the science behind the parallel, why treat musicians as athletes? People think of musicians as just artists, right? Like they are different. They don't need to do the workouts and things like that. But if you watch closely, and me having worked so closely with both musicians and athletes, I can confidently say that musicians embody everything a high performance athlete is. The demands placed on both of them is remarkably similar physically, mentally, emotionally. And as we go through this talk, you will see that. Both require an intense commitment, focused practice. They both have to practice, put in long hours and disciplined routines and a high level of physical and mental conditioning. So if you look at the overall picture, they literally sound the same. If you didn't know who I was talking about, you wouldn't know whether it's a musician or an athlete. So it's just a myth that musicians are just artists. Their bodies endure the same athletic demands. There have been research after research that suggests that musicians go through a lot. It is estimated that almost 60 to 90% of musicians will suffer from a music performance-related musculoskeletal injury during the career. While athletes primarily rely on gross motor skills, musicians rely on the fine motor skills, but they both heavily depend on their core strength, the stability, endurance, to hold the form, to perform with accuracy and neuromuscular control. To execute a flawless performance, whether it's a winning shot or a complex musical passage, both professionals in their field must blend speed, precision, resilience. This level of mastery just doesn't occur by accident. It's a result of a lot of hard work and structured training. And that's what we need to give to these musicians so that they can perform without any complications or injuries. So if you look at it, physical demands, it's an endurance game. Athletes perform at sustained peak output for hours, while musicians play at the same intensity for 3+ hours. And so they both push through the physical limits, producing identical strains. At the core of this healthy playing is good posture. The way as therapists we need to look at it is, whether they have that core stability. Musicians often maintain static or dynamic postures for extended period of times. When those postures are ergonomically sound, they support smooth, efficient movement through kinetic chain, which is your, if you think about it, fingers, hands going down your elbows, shoulders, all working in a sync with a good posture. But when the posture is poor, that repetitive stress injuries happen, and that results in your tendinitis, bursitis, carpal tunnel, neck, shoulder problems, and all that tends to follow. So postural correction should be the central focus in rehabilitation of that injured musician. Precision and control. If you look at athlete or a musician, both need micro precision. They both face career threatening injuries, and that is one of the biggest problems with these musicians. When I explain to a musician when they come in, I use this tree analogy. So, it's like your fine motor when they're playing, it's like the flowers blossoming, right? That's what's happening. So, fine motor control, musicians require that precision to play an instrument. A finely tuned motor control, particularly the small muscles of the hand and fingers, it demands that synchronized yet differentiated motor functions. Gross motor control is your branches, larger muscle groups. It supports your posture, movement, and stamina during performance. Your core strength, it's your the postural muscles that holds you up, supports you, and provides that efficient gross motor coordination and reduces any compensatory strain. Your core stability provides foundation for balance, limb control, and sustained engagement in play. So if the core is strong, the branches would be stronger, and then the fingers are going to do a better job playing. In addition to all this, there's a sensory motor function that needs to be assessed. Successful performance requires a seamless communication between what you're inputting, your visual input, and the motor output. A visual feedback sheet, for example, is something where they have to watch it while they play. Sensory motor information from the instrument helps performers adjust the finger pressure, the positioning, and articulation with precision. Usually, a prone hand performs the melody while the other hand performs the harmony. So, all these come together for the musicians to perform well. And if any one of them is flawed, that's when the body starts to break down. So, here's my little kind of similarities versus differences between your musicians and the athletes. And there are many studies out there that talk about this. If you look at it, they both need, your structural activities. One focuses, actually, I would say both tend to focus on the fine, the tweaking of things, but musicians mostly are deal with fine motor control versus athletes are more into gross motor controls. The thing which differs is injury risk. So musicians tend to develop more like the focal dystonia, movement disorder type problems, whereas the athlete will develop trauma, like traumatic injuries and things like that. But the mental pressure or the performance pressure when they are performing all tend to be pretty much parallel to each other. They both, and that's the reason why they should be treated similarly and not differently. One of the things that the musicians have to face is mental pressure, and that psychological problem can result in a lot of painful conditions. They often say that, pain resides in the brain. I like this chart in the middle where, some part of the pain is biologic. It's what's happening. They're using it incorrectly and that's causing it. But there is a level of that psychological and social pressures that is so high on these elite musicians or athletes that adds to the pain, and it increases the perception of pain, what they are feeling, as it's deeply connected to the mental health. So whether it's from live solos to penalty shots, make it or break it, win or lose, glory, there's so much riding on these musicians that if we don't address that mental pressure that they are facing, you will not be completely be able to treat these patients. So there is a certain aspect that you do need to talk when you're treating these patients about how to handle these mental pressures and how to deal with it. Whether it, just like an athlete can benefit from mental conditioning, brain exercise is equally vital for musicians. Training the mind can significantly enhance their physical performance. Techniques such as motor imagery, mental rehearsal, visualizations are powerful tools that boost skill execution and facilitate recovery. Motor imagery practice, which I use quite often with my patients, is like mentally rehearsing a piece of music without actually physically playing it. This form of training activates the same brain regions that engage during an actual performance. As a result, it helps maintain and even improve motor functions, especially during periods of rest, rehabilitation, or injury recovery. There was a study where they casted 20 healthy participants with a plaster cast on their non-dominant hand for 3 weeks, and they engaged in visualization, imagery, and a therapy session with a therapist. The home exercise program was 15 minutes of movement visualization, and they found there was a huge amount of cross transfer and improved function after the cast was removed. So there is something to all these techniques to help these elite athletes deal with these mental pressures, to manage them better and to reduce that the increased perception of pain and manage them better. So career disabling injuries happen in both. And it's a shared battle, whether it is, whether they get tendonitis, carpal tunnel, or focal dystonia. That can happen in musicians versus, an athlete can have tears, fractures, and those type of injuries. But both result in a halted career, which jeopardizes both of them equally. So what causes these career disabling injuries? There are many aspects to it, and I'll go one by one. Personal characteristics, age. A young musician, if they are supposed to have had few where they were playing music piece that was too far out for them, where they couldn't even reach, like they're playing the piano and they couldn't even pan couldn't reach that far, and before they've even learned the scales, the parents are pushing them to do more, versus in, an older athlete, older musician. The problem would be they have arthritis and they have to deal with that, and how do you teach them how to manage their symptoms? um, at times, I feel like dealing with older musicians is much easier because you can explain to them and, all that. Um, but the young musicians sometimes become a huge problem because the parents want something else. They want something else. The teacher is saying something and they're listening more to the teacher than to the parents, and then you come into the mix and you're giving a different story. So it's a lot harder to deal with these younger musicians than an older musicians. In an athlete, the problem is usually the parents are pushing the kids are actually fine, but in a musician, the kid becomes, you have to unravel another layer of this mental development characteristics. And I'll talk about one that I think I wrote few chapters just because of that girl. But that's something you need to deal with. Your environmental aspects, when they're playing, whether the temperature is too cold, that would make everything tighten up, or, is it too hot, confined spaces where, they have to function and they're sitting in awkward positions. And that can add to the problem if they're playing for 3 hours. Physical demands, how much force are they executing, the amount of repetition, are they taking breaks, how much gripping is required, are they using any adaptations to help make it easier for them to use the instrument without actually causing an injury. All of those things are important besides your physical fitness, your strength, flexibility, and endurance, which is what we will help build them up so that they do not develop any injuries. So how does this career disabling injuries happen? With extremely long hours of practice, performance the following chain reaction occurs. Mental fatigue sets in. The brain loses its focus. Form begins to deteriorate. Subtle breakdowns go unnoticed. Fatigue leads to strain. Muscle tires out, and compensatory patterns start to emerge, right? Your posture start to, you start off nice and then ultimately your posture starts to deteriorate. Your alignment goes off. Then that results in the technique, starts to suffer and falter, and that improper mechanics becomes the default if they're not if they don't have a full-on core strengthening endurance buildup. And that's how your repetitive strain happens, whether it's a musician or a non-musician. This is how it builds up and causes long-term damage. So how do we treat these patients? Besides what the problem is, they came in pain, tenderness, all of that. Besides that, we need to look at the medical history. Do they have any systemic conditions that could be adding to that? I look a lot, especially with my younger musicians, EDS issues. Are they really hypermobile? Any other health conditions, or did they have trauma that's limiting the function performance, and do we need to address that? So that's one part of it. Another part is watching them play. How do they play? And what I do is I make them bring the instrument in the clinic and just tell them play. I want to see how they sit, how they stand, how they're holding, like what their normal patterns are. That's when you figure out, okay, this is why this problem came about, because they just have developed these bad habits, and that's the reason for it. So you need to watch them in clinic. If of course you can't bring a piano to the clinic, so videos, get somebody to take videos, and if possible, if you can go watch them in their settings. I talk about trauma. This particular patient, and this is his words, uh, he had broken, I have no idea how many bones. He fell off of a cliff and lost consciousness and all that. But 5 months later, work on the problem, work on the core, do all of that, and you can actually get them back to playing. And that was in 5 months. We were able to get him back on track. So how do we assess? In clinic, basically what we are looking at is the kinetic chain. Everything has to deal with from the biomechanical aspect of it. What are the static postures? What are their dynamic postures? And you do this kinetic chain assessment, what normal movements are and what abnormal movements they're doing, and figuring out what's right. So when we're assessing, you want to know whether it's a tendinitis type of problem, nerve involvement, or movement disorder. Who, what, when, where, why is this happening? Your physical assessment, what hurts, what are they playing? what's their posture like? When you give them, when they take the instrument out and sit down or stand, whatever, how is their posture looking? Uh, are they playing a lot of fast pieces, or they're balancing out with slow and fast? Does it conform to the norm? Does their posture conform to the norm? What they're playing? Are they too young to play something like that? How are they seated? Are they overworking any certain movement patterns, like one hand doing too much work? Are they holding it in a wrong position? All of that needs to be assessed, because that will give you a picture of why this problem is happening. And we'll see videos uh, where you'll notice certain movement patterns. There's like in this harp player, you can easily tell that this person is going to get second dorsal tendonitis because she's extending that wrist and resting and trying to play. She will also probably develop shoulder issues, because reaching out for so long, that can result in shoulder tendonitis, let alone that posture, sitting in that position if she played for too many hours, will result in some nerve involvement at the brachial plexus level. I actually had a harp player who played at the Olympics in England, and she had to carry that harp and do choreography with it. She couldn't roll, they didn't let her roll the harp, carry the harp on some kind of stool. She actually had to carry. So when she came in, she was literally lopsided. There was a traction injury with all the nerves involved. And so sometimes they're doing things that are just unreasonable, and well, they did it, now they're in your clinic and you have to solve it. So you have to look at all of that as to why that happened. So assess the static and dynamic postures, holding pattern, speed, of which they're playing, what is underused, what's overused, so that you know what to stretch and what to strengthen. And, with the patterns, you'll figure out where the nerve entrapments are going to be present. Usually with any of these static postures, you will find that there is the toning muscles tend to get tight or shorten, and the phasic muscles usually never work. That's why the core is lacking, and so they're not strong enough to hold themselves up, and they're weak, and so that's what you have to strengthen. So you'll get patients who come in with movement disorders and things like that. So this is a patient at the evaluation and the end result, and you will see the problem. So if you watch his fingers on his right hand. Stop to the. I can't forward this. It's delayed. So if you see the middle finger, can you guys see my arrow?
Sometimes, yeah.
So the middle and the ring are a bit slow.
Especially when
Especially
playing
the
in a
middle.
really hard tune where it just caused my hand to freak out. Yeah.
So his movements are sluggish. He cannot move it as fast. It doesn't come down and press it at the right time. And this is his end result. You can see how faster that music is played, and there is no there. So how did we go about? How did we figure out what the problem was from that little, playing, and come up with an answer? And I'll go over that. There's another case. This wasn't music related, but it's the same movement disorder, focal dystonia. So you can see the tremor that she has. And I figure out where the entrapment is. I release it, and I can actually pretty much hold it. Look, I leave the pressure from it, and it literally reduced it to none. Relax. I know, sorry. I have to release it. Bye-bye. And then this was at the end of that same day.
Barely.
I didn't record So how did we do that? How did we go from this to this, right? Another example, this was a musician who played for 2 or 3 months for hours at a church and came with sensory complaints. And so when he came, I just said, okay, play, and look at how he sat. Like literally, this is how he used to sit.
This is my first time playing since March.
Oh, all right. So he starts to play. Take your so elbows bend more than 90 degrees. Look at his posture. That just that is putting tension on the nerve, right? And he played nonstop. That causes problems. You remember? So wrist is going and slight ulnar deviation and like not bad, but still over time it can add up. So, and then this was another harp player. Look at her wrists flexed, shoulders are out. Sometimes it's a simple correction. Down over there, correct this posture. Okay. So she came with carpal tunnel on her right, but we found that she also was developing tendonitis on the second dorsal on her left because the way she would extend her wrist. Is this more than the other side?
No, this side's way worse.
Yeah, because that is the hand that is like posture is bad. This side is actually better.
Yeah.
This side, the posture gets.
This side, one thing that I think that's what causes the pain over here is
It's because, yeah, when you're extending. So, yeah, you have to make sure before. So. No, let me move forward. So how do we assess? Basically, especially with movement disorder, you want to assess when they're playing what their complaints are and what movement is either inhibited or over activated, right? So you're observing the movement pattern. And we teach, by the way, all of this in our courses. So you observe the movement pattern where it's going, like in that person with the extensor tremors, you know the extensors are overworking. So they might be tender along the path of the extensors, which is where you're going to find the tenderness in the extensors or the radial tunnel or things like that. And then you can do the provocative test, which may or may not be positive. So that's why you involve your scratch collapse test, your upper limb tension test, all of those, so that you have a cluster of information which you can then say for sure that this is the reason why this is happening. So, and you, after that, once you figured out that, okay, this is the movement pattern, the radial tunnel might be the area, you release the pressure and see if the tremor goes away. And if it goes away, you know that's what you have to treat. You tape it, you provide exercises, and that's how the treatment happens. For the kid with the where he couldn't put the pressure, like his fingers just wouldn't come down, his problem was in the lacertus and flexor pronator mass, and that's what we treated, and that got him the result, and we were able to relieve the pressure from the nerve. So there's always a nerve involvement with these movement disorders. At least that's what I found. That's the data I have put in the book, and you can go look at all the information that I provided. I don't have major studies to show, but if you practice it, and I've had other therapists who we've taught these techniques to, they go assess it and they found the same thing. So if you guys want to do a study, please go ahead and do it. So ULNT grading. A lot of times the nerve entrapment is so subtle that you actually want to see where the restriction is happening because your provocative test may not be positive. And for that reason, the ULNT grading or the scratch collapse test actually comes in very handy. ULNT grading will kind of help you hone down exactly where the problem is. It could be at the brachial plexus, at the elbow, or whatever. And then your scratch collapse test can help confirm that that's where the entrapment is. So you can use all of that to derive to a diagnosis. And then the myofascial mobilization techniques that you can use. This is a very long video, so I don't know if I can. Let's see if it'll move forward.
So they may
I
either
can't
have
move
pain
forward.
at the lateral ipsi
So
or
it's a 30-minute video, so we can't play it, but I showed these techniques, how to do the myofascial immobilization with the nerve glide and treat these patients through it. Another aspect of it, of music playing, is ergonomics. So what is ergonomics? It's what fits you. It's the setup, the use, how much you're using, are you taking breaks? All of those matters. For a musician, it's how they're holding the instrument, how much they're playing, the speed at which they're playing. So you need to have an account of all aspects of them playing the music. So a lot of times they'll bring pictures of, as you saw, the instrument, and then you assess and you figure out where the problem could be, how they're standing. If this person was standing for many hours, they'll definitely have not just back pain, but a lot of shoulder and neck problems. So looking at all those is important. Start with the seated or standing posture, whether the shoulders are relaxed or they're constantly elevated. Elbows kind of, if possible, 90 to 100 degrees, wrist neutral, not an extension. If the elbows are flexing, as you saw in that, either in the skid or the guitar player, they definitely over time will develop ulnar nerve problems. So musicians, much like athletes, require that biomechanical efficiency. Personalized ergonomic setup paired with proprioceptive feedback. So I use a lot of taping, and I'll show you that. Along with the adaptive devices, all of that can significantly reduce the risk of injury and enhance the performance quality. The aim here is not only to prevent injury, but to optimize these artists' ability to express their craft without any physical injuries. So that's the goal over here. Another thing is adaptation. Usually the instruments are pretty expensive, so you really don't want to stick anything or do anything like that. There are a whole bunch of adaptations available in the market. So you may want to, I basically provide them, this is what neutral looks like. You deviate from this, it's going to cause problem. Now, how do we bring you back to neutral? And then we go from there. There are times I've had like a saxophone player one time, and I guess he was some big name, and his posture used to be always like this, and then he endorsed a strap that was literally gonna pull his head forward, and I'm like, why did you ever do that? But they don't know, a lot of times that's wrong. We can see the posture and then say that this is going to cause a problem, but they are not aware of it. Similarly, I had this girl with EDS, Ehlers-Danlos syndrome, and she was playing an oboe, and the oboe is so heavy, and her fingers literally were so bendy that she couldn't even hold it. So I asked her to put it on the stand. Well, the teacher suggested a strap. This girl is so hypermobile, you don't want to put additional pressures, something that is going to add to the postural, compromise the posture. But guess who wins? A lot of times you do not. And it's hard. especially if the parents are also not on board, it becomes very difficult. So you have to look at that music stand height, adapt bows. You can adapt the bows by putting something to make it wider. Um, Chair height, playing posture, adjusting their the bridge on the or the fingerboard to reduce the amount of pressure needed on the strings. There are a lot of examples that can be used so that they are not putting too much pressure, like replacing the tuning pegs with options that require less pressure and resistance can help offload the musculature. A lot of times, when we suggest how they hold, people with EDS tend to hold with that, this pinch pattern. You want to educate them on that C curve. A lot of times I'll tape them so that they can feel the pressures where it needs to fall, and then they practice with that position. So all of those things help. You have to literally provide them with the biofeedback so that they can play effectively. So like this person who was playing with the wrist flexed and elbow flexed, what we did was we taped his elbow and then we taped his wrist. And then at the first sign of pull that the person would feel, that's when they would stop. And then they would retrain where they need to sit, how they need to sit, and then start playing. And that's how they practice and correct themselves, because it's a constant biofeedback. You can't say do this and then leave them alone, because they'll go back, they'll do what they know best, which is all the wrong postures. So you have to provide them with the feedback. You have to provide them the education of how to tape themselves or a family member, and so that they can tape it when they're playing and then practice with the correct biomechanics. And that's how you start making progress, by correcting their techniques, not the techniques, but their postures, the biomechanics. So with this particular girl, again, we taped her, and then we got her to tape. This one is not with the taping. It's the same video. So I had a picture somewhere. There it is. So I taped her on the back, so that one hand we taped in the front, one hand we taped in the back, so that she could provide play with the correct mechanics. Oh, taping. So how do I tape? I use a lot of leukotape in my practice for proprioception, because it's a sturdy, I call it duct tape for humans. It's a sturdy tape that prevents movement, prevents extension. So they get a feedback. It's basically low tech biofeedback. They do the wrist extension, they can feel that there is a pull, and it retrains them not to do that activity, and they find ways around it and work their way around it so that they don't keep irritating the tendon. So that another thing you want to look, especially with musicians, is do they have hypermobility, especially when your younger musicians are coming in. And because this requires a totally, again, it's a biomechanical inefficiency that is present in the body, and you want to be able to provide the support, whether it's strengthening, endurance, or splints that would be needed to make sure that they can play without actually injuring themselves, especially in the long term. These patients usually have low tone, so that's another, it takes a lot longer to build their muscles up. If you can see this, this was the oboe player. Yeah, you doing that. So see, she has to put that, her putting so much pressure. And that in itself, you saw how much pressure she was putting, and she was so hypermobile. If that's how the thumb is, you can imagine what the whole body could be. And she's playing this instrument, and one of the first things I do with these patients is I check the core, and we got her to do planks. She couldn't even do 5 seconds of it. She was so poor, like her core control didn't exist. And she came in with declamains, but look at her thumb position. There's no C positioning. We suggested, she get these oval aids. She needed a support to hold it up. The parents weren't interested in buying any of it. They literally wanted her to give up the music, whereas she wanted to continue. And that's a huge, totally different. I wrote a chapter just for that. Besides strengthening, you have to strengthen certain muscles so that they can actually use it correctly. And you can start with your static strengthening, teaching them how to do the C positioning. So here they're picking it up in a C position and then strengthening the same muscles, whatever fingers are involved, and you go from a static to a dynamic isometric strengthening, all of those just to build up the muscles. So see what's involved, what you need to correct. You can tape it, splint it, and then add the strengthening exercises. But correcting movement patterns is literally the most important thing before you can give any exercises. And of course, once you decide, figure out what the problem is, then you can start adding your exercises. So
Planning to open up the carpal tunnel.
So a lot of them come with carpal tunnel syndrome, so this is an easy example.
The affected hand, and the hand you'll use to perform the stretch, the unaffected hand. Anchor the affected hand to your stomach by placing it on your stomach, palm facing your body. Rest the pad of your thumb of your unaffected hand to the affected hand. Slowly and gently push your unaffected hand, the palm of the affected hand outwards, away from your body while keeping the affected hand anchored against your stomach. Hold this gentle stretch for 5 to 10 seconds.
So that's how, it's like we have videos, and I usually give them QR codes and things like that, so that they can watch the videos and do the exercises. If they have hypermobility or EDS, a lot of the exercises are mid-range strengthening. You do not want to give any end ranges, because that will stretch their tissues out. Blood flow restriction therapy is really useful for these patients, because they can build up muscle much faster without less stress on it. Basically, you're tricking the brain to think that there's not enough oxygen, which sends in, the growth hormones, which allows for that muscle to build up faster. So that's what you're doing with these patients. A lot of proprioception with taping and with exercises, so so that they are not putting too much pressure on the string or on the keys when they're playing, and not damaging or creating more itis or nerve issues. So this particular patient, need to be like this. So she couldn't even hold herself. Her intrinsics were just weak. So here, you might have to go big. And the difficulty is you're trying to make videos while, at the last minute. See, and when I'm doing it, my hand is not going like this. It's slightly curved. Fingertips are still touching, right? And then I'm going halfway. When you do it, it just collapses. You don't have control over it. You need to keep it here and then go. So the goal is to put the pressure only halfway, so that they're not popping through. This way they learn how much pressure to put in the correct posture.
So is the form I have now correct?
No,
Yeah.
because you don't have the strength to
Yeah.
hold yourself.
It's taking effort to do this.
Exactly, I know. It looks very simple,
Yeah.
but it's not. So she goes from that, and we gave her some lumbrical strengthening. She had arthritis, so I created this so that she could just build her strength. You can use putty, rice, whatever the strength is, you can do that.
Yeah, it stands for?
That's so remember your hypermobility. So she made it, I think, in the end. I can't remember, but that results in that's where you're being. So you can design the exercises. Always make sure with musicians or even your regular keyboarders, what you want to do is use the fidget popper device to go halfway so that they're not popping through. First with the eyes open so they can see what they're doing, and then with the eyes closed so that they now have the proprioception to only go that much amount, because when they're playing music, they're looking at the sheet music, they're not looking at where the hand's going. So you want to do it with the eyes open and then with the eyes closed. So and then translating that into the playing, it's like when they're learning to play, you begin by practicing to the point of this that sound, that subtle bump that they feel when the key is slowly depressed, without actually producing a sound. Applies to acoustic pianos, but you get the idea that the sensation can be practiced similarly during therapy with those fidget poppers, and making sure that they put that much force when they go back and play the piano. And then comes the core strengthening. So just like an athlete, you want to build that core, because if the core is not strong, these extremities are not going to function the way they're supposed to function. So, then you start designing their athletic endurance, core building exercises. There are many studies out there that show that the stronger the core, the grip strength actually increases if you strengthen the muscles of the core and shoulder. And so you always want to include your core strength, your shoulder scapula stabilizers into your program so that their output then becomes seamless and without any problems, any further injuries. And then you can use your taping to treat. One is for proprioception that I showed you with the Leukotape, and this one is for treating, like they have carpal tunnel, so you're opening up the carpal tunnel, and this is one of the taping techniques that I do. And I'll play both at the same time. How am I doing on time? So it's providing carpal fanning. You open up, you make two tails go around, and then you wrap around the thumb while providing 50 to 75% of the stretch. First going from top and another one coming from the bottom. And on this side, we're doing radial tunnel taping with the Leukotape. We're holding, so basically releasing the pressure from the two heads of the supinator so that the radial nerve doesn't get entrapped. And that way, you release the pressure. And that's how we treated that lady with the extensive tremors. When they're ready to go back to play, it's all about endurance. An elite pianist logs like 10,000 hours by the age of 20. So injury resilience comes from cross-training musicians, just like athletes, because if you don't build them up, they cannot keep doing this forever. You need to build these muscles so that they can, it's an endurance game. They can play for long hours without breaking down. As I stated earlier, pain gets enhanced if there's psychological social problems, right? So one thing I use a lot with my musicians is mindfulness training, especially the body scan technique, where they scan, from a higher level going as low to a cellular level. Where this is how I give the instructions. Like imagine, okay, you have this pain in your wrist, and you're imagining that pain going from they close their eyes, and then they imagine it's going from one joint to the next. So it's like from the they can go from here down to MPs, PIPs, DIPs, and out of the body, or they can go like an elbow, shoulder, and then out of the head. Whatever they want to choose, they pick. And then they start going smaller and smaller level until they're at the cellular level. So basically, they're just imagining that the pain is going away. And that's a form of meditation that helps calm their mind down and helps with that emotional issues that they deal with. So body scanning, visualization, mental rehearsal, all of these help along with your breathing and guided imagery. Mindfulness usually often cultivated through meditation and breathing techniques. It's a cognitive and emotional skill that involves maintaining focused attention and enhancing present moment awareness without judgment. For musicians and athletes, it's a function as both performing, it's like a performance enhancing tool that can be used. Before the performance, they can go through this meditative process, and it works as a protective buffer against emotional demands of the profession. And they can easily manage the stress that they have to do by practicing these mindfulness training. And athletes rely on the same thing. They have sports psychologists, so musicians don't. So they can use these techniques. You wish that musicians also have not sports psychologists, but music psychologists that can help them deal with all the mental health issues, as there's a deeper connection between your emotion and your movement. So there has to be more studies done in this matter, but whatever you can offer, that goes a long way. I usually have a 10-step to bring these musicians back to playing. So it's like when I'm treating them in therapy, they start to play. Their instructions are: the first sign of pain, you stop. You notate the time that you've spent, and then you practice that as an exercise, 3 times a day. And then you do it consistently, and then you gradually increase the complexity. If pain happens, you're continuing with rehab. You're not quitting. You're still doing the exercises that has been given to you. And then, you make sure they know how to tape, and they emphasize on the technique, proper ergonomics, all of that, and let them be the judge so that they have that self-awareness where the arm position needs to be, especially during practice. And include the rehab, making sure that they are doing the exercises, working out, all of that, maintaining the physical condition, so that they do not break down and have this long-term sustainability. We all know prevention is better than cure. So if you can prevent these injuries, that will help them build their career and not have a breakdown. So what all is needed? Flexibility to play repetitive motions without injury, teaching them proprioception and how to feel it, know where it needs to be, how much pressure they need to put. Core and postural strengthening, mobility works, your cardiovascular conditioning, and of course the mental acuity, the ability to process all the complex movement patterns is essential. All of these techniques that I talk about related to the musician can be applied to any patient, as long as you look at the core, look at what they're doing, assess what the problem is, and then treat it properly. The aim is to not only prevent injury, but to optimize the artist's ability to express their craft without physical limitations. Teaching these strategies early and reinforcing them consistently. Making good habits is the key, right? Undoing those bad habits is harder, but if you form good habits, that's the key. So reinforcing them consistently so that they don't fall, go back to that old movement patterns is important for their long-term health. Healing the hands may begin with splints, exercises, and taping. but sustaining the musician starts with healing the mind. So always keep that in mind. So research has shown that music training induces neuroplastic changes and enhances brain activity in the brain, and is associated with auditory processing, motor control, and focus attention. So these changes closely resemble the adaptations observed in elite athletes. So whether it's musicians or athletes, reinforcing the importance of treating musicians at the same level of physiologic and psychological care. Just what an athlete gets is what I would say the reason why we should treat them same as what athletes get. Thank you.
Thank you so much, Saba, for this interesting and inspiration. We truly appreciate your sharing your knowledge and your experience. Thank you so much.
Welcome.
Before we close, we would like to know about an upcoming in-person course related to today's topic. A 2-day course on treating musicians as athletes will take place on Saturday, April 4th and Sunday, April 5th, 2026 in Lugano. This course will be taught by Saba, of course, together with her colleague Hashim Bashim. We will expand on the concept and clinical strategies introduced in this webinar. So there are some questions for Saba?
Sure. Yeah, so the course will be more hands-on. So we'll show all the techniques, how to assess. And if you can have musicians over there, that will be even better. So you can actually see live as to how we do it. And, the attendees will get a lot more out of that. Questions? No questions?
Hi, Saba.
Hi.
My name's Nerissa. I'm from South Africa. I encounter quite a bit of thoracic outlet syndrome in musicians. How often in your clinical experience do you pick up on these neurogenic task patients?
Actually, quite often. The one that I talked about, the harp player, she had full on, brachial plexus involvement. It was like a Parsonage-Turner syndrome is what she came in with, right? So yes, their postures, what they're carrying, sometimes if they're carrying heavy loads, that can provide the traction injury. So that's why I talk about that ULNT. You do have to do the upper limb neural testing so that you can figure out where the entrapment is. They may present something else in the hand, but if you don't look at the posture, the head position, and assess the entire length of the nerve runs in continuity. So you want to assess the entire length of the nerve to see where the problem is and then design the program. A lot of them may have scapular dyskinesis that could be adding to the brachial plexus involvement. So unless you treat that scapula is going to keep impinging. So it's very important that you assess that first, provide the treatment, and that nerve will definitely calm down from there.
Thank you so much, Saba.
You're
Thank
welcome.
you.
Any more questions? All right.
Okay, so thank you so much, Saba. Thank you, everyone. So we wait in Lugano.
All right, we'll see you guys in April then.
Perfect. Bye.
Take care. Bye. Bye.